And I would like to introduce, a lot of you know Deidre Kindred. She's actually one of our board members, longtime nurse, and has her own health advocacy business. But I'm going to let her introduce herself because she has a long bio, lots of experience. And I also wanted to make sure everyone knows Angie Ingram, who's at the top here. Angie is going to be starting to run the case reviews like I've been doing, probably in the next time we have one. So Angie's also on our board and is a physician with her own practice. So we're excited to have Angie involved. So with that, Deidre, will you take it away? And also, I didn't talk about the title, but I'll let you do that, Deidre. Title of the case review.
Oh, okay. Well, hi everyone. This is very informal. I'm so glad you guys decided to join us tonight. So my name is Deidre Kindred. I've been a nurse for 25 years. I started this company, Your Healthcare Nurse Advocates, in 2019, September of 2019, and then COVID hit in 2020. So I feel like working in the healthcare system, I've worked in ICU, CVICU, MICU, legal nurse consultant, IVIG infusion in the home, and regular ordinary home health, which is never ordinary. And I found out that there were many, many gaps in our healthcare system. Being blessed to be able to be in different genres. It really hit home when my mother, at the age of 55, she started showing symptoms of Parkinson's or MS. And it looked like it could be either or because they have some of the same symptoms, but they're treated totally different. So that was an 18-month long journey back and forth to the doctors to find out what it was. And then I realized then, because she had a pulmonologist for asthma, and she had an oncologist for colon cancer. So she also had the GI doctor, and then she had the neurologist and her PCP. That's five physicians that didn't have the time to talk to one another. So since I'm the nurse, couldn't be at all the doctor's visits, other family members would have to go, and it was confusing. They didn't know what to ask. So it was put on my heart by my Holy Savior to start Your Healthcare Nurse Advocates. So we are educators, advocators, and navigators. We are in the great state of Texas, and we are all alone sometimes. So tonight's topic, and jump in for questions whenever, is about tailored home care, meeting diverse needs under one roof. So I obtained these clients as a baby advocate. So they were one of my first clients. So the client's goal was to establish and integrate home care assistance and resources for her older sister with special needs, and then her mother also with chronic illnesses after relocating from Arizona to Texas. So we have three clients nearly under one roof. We have client number one. Her diagnosis is Russell Silver syndrome. I don't know who's heard of Russell Silver syndrome, but I hadn't. So the challenge was to find not only service providers that knew what Russell Silver syndrome was, the challenge was I had to find out what Russell Silver syndrome was. So I'm so glad you asked. It is a rare genetic disorder characterized by intrauterine growth restriction. So it typically presents at birth. So they have a low birth weight and they may have poor postnatal growth. This results in a short stature. So my client is, at the time she was age of 36, and she was about 4'2". So she looks like an 8-year-old sometimes, but I had to realize this is a grown woman. So I described this Russell Silver syndrome as like a combination of Down syndrome, moderate stage Alzheimer's, uh, intellectual development uh, delays, and ADHD, 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 ADHD. Meaning when I first met this client, she slept 30 minutes in a 24-hour period. 30, not consecutively. So client number two would be her mother. So her mother had been taking care of this client all her life. This was her life. But mom, unfortunately, never went to the doctors. She never did any preventative care or anything because mom doesn't drive. She doesn't have internet. She has no teeth. And she has maybe a sixth grade education level. Client number three it's not really a diagnosis, but is caregiver burnout. Because this is the other daughter who currently was at the time staying in Arizona and did not want to move to Texas. She hates Texas, but she was forced to move to Texas eventually because, wait for it, mom and daughter moved here in October of 2020. I'm hired to care for the Russell Silver syndrome client and get her acclimated to Medicaid and some resources. But mom has a stroke in December of 2020. So let's go back to our problems. So they're new to the DFW area, Dallas-Fort Worth area. We need to obtain Medicaid services in Texas because she was on Medicaid services in Arizona, and each state with Medicaid is totally different. And I'm being told that Texas is one of the worst ones in the top 10. Mom doesn't drive. She has no internet. She's difficult to understand pre-stroke because she doesn't have any teeth. And she has maybe a sixth to eighth grade education level. So caregiver number three, the third daughter, who is not the baby, she has to move to Texas because when mom had the stroke in December of 2020, she really couldn't move here to March of 2021. Did I tell you guys that she doesn't have a car? Mom doesn't have a car? It is really hard in Dallas-Fort Worth if you don't have a car. We don't have the elaborate trains and buses. Our bus systems are very limited. So I live at least 90 minutes away from mom. So mom decided to move into a apartment complex, but it was mostly college students. So you got a 65 plus lady who doesn't drive, doesn't use the internet, um, moving into an apartment complex of college students, and she has a special needs daughter. Let alone that, remember she has a sixth to eighth grade education. So when daughter with Russell Silver syndromes has outbursts, these turn into volcanic episodes because mom doesn't know how to de-escalate or control her temper. So APS was called quite a bit, but that's another story. So a fellow advocate from Arizona called me up around August of 2020 and asked me, her clients were moving from Arizona to Texas, and she asked me, would I be able to help the client with Russell Silver syndrome get on Medicaid because they're limited income, mom has low education, and they're wanting to move to Texas. And I was like, ooh, okay, sure. Um, okay.
And you're a new advocate, right? This is
Baby
like,
advocate, baby advocate. Know nothing about Medicaid, acclimating Medicaid. 211 number sucks. Sorry, you're gonna get it. It's awful. And mom doesn't have internet. So it was a lot of phone calls with the daughter that was getting ready to move to Texas in between time. So I had to learn about Russell Silver syndrome and let alone find providers. I still haven't. Fast forward 4 years because lots of times I was educating myself so I can educate the provider on what this was because they didn't know how to treat it. The research for Russell Silver syndrome seems to cut off at 21. I can't find anything past that with what these clients may need. But I did acclimate that she will need a cardiologist because she was born with a heart defect. She will need a gynecologist that is willing to work with a special needs. And there's another layer that we needed for the gynecologist. And she needs a primary care physician and all these resources. And she needs to be on the Medicaid waiver program. So back to October, mom, oldest daughter, she's the oldest daughter, the one with Russell Silver syndrome. Um, the daughter that's moving here, we had a conference on the phone so we can get them acclimated to our services at Your Healthcare Nurse Advocates. So I identified, after my evaluation, I identified that in order to successfully have everybody age in place, because mom wanted to age in place with her daughter. So October they move here. We get mom's easy, get a primary care, no big deal for her. She's 65, no problem. This is before the stroke. Uh, the daughter with Russell Silver syndrome, that was another challenge. But by God's grace, I was able to contact Metro Care, which is a Medicaid special needs MHMR program run by Medicaid here in Texas, where they can get acclimated to resources such as physical therapy, occupational therapy, but the wait list is years. So when mom has the stroke in December 2020, they put client number one into the crisis intervention program. So that was our saving grace. Because when they put her in this crisis intervention program, mom had the stroke. She was diagnosed with obstructive sleep apnea, diabetes, hypertension, stroke, and she needed to go to rehab after her hospitalization. But what about the special needs daughter that needs 24/7 care? So, of course, the state steps in. They want to put on the crisis intervention program. They want to take her and put her in a foster home, take her from mom, period. So we had to be able to fight to help mom advocate that she is trying to get these resources. Her baby daughter is coming here in March, so she will have the supervision and safety and everything that she needs. So it's just going to be temporary that the Russell Silver syndrome client is going to stay in the foster care until mom goes from the hospital to rehab to back home on home health. And then mind you, we're working with the hospital, rehab, and home health for mom because we're following her through the entire transitions of care. Meanwhile, special needs, you can't put them in a changed environment. Ugh. So that brought about many, many, many issues. I'll pause here just in case anybody has any questions. No? Okay. We're going to keep on going. So in March of 2021, after the daughter was able to move here, disgruntledly, she hates Texas. Her saving grace is that she was married to someone in the military and she has a dog that's her baby. So she was able to relocate to Texas and get herself an apartment about 45 minutes from mom. So that had me implementing a plan of care that we need to do weekly in-home wellness visits. And the weekly in-home wellness visits consist of, hey, we got home health company ABC. We got this doctor's visit coming up Monday. We got rehab coming up Tuesday. It was always about planning the plan of care. So the Russell Silver syndrome client needs a totally different plethora of services. That's totally different from the services that I'm used to when you're dealing with 65 and above. Finding home health people, personnel, doctors that were patient, willing to learn, and not just brushing somebody off was difficult. I fired so many of them. home health would come in and they would automatically go to not listening to mom because they would get frustrated because remember, mom doesn't have any teeth. She has like an eighth grade education. So the mentality is kind of like if you had a 12-year-old that couldn't focus and didn't understand the inner workings that we got to get the referral from the doctor, get it approved by insurance, wait for insurance to call, do all the approval. She didn't understand the back office paperwork or anything like that. She's very impatient, right?
Deidre, what did the Russell, what is it called? Russell Silver syndrome, um, daughter need? Like actually, could she do her own?
No,
Okay,
that's a great
okay.
question. Thank you for asking that. So the Russell Silver, she could say maybe 3 or 4 word sentences. She didn't have any teeth either, but she can eat anything, anything. With the ADHD, she was always moving. And this would irritate mom, and mom would yell out at her. She did not need physical therapy. She was able to walk. She's called what I call walkie-talkie, but she did need 24/7 structure and supervision. And there was no teaching that structure and supervision to mom. So when we got her acclimated on the Medicaid waiver program, then they would have physical therapy, speech, OT, and behavioral health. We finally got a behavioral health therapist in there to teach mom how to do some coping mechanisms because it would escalate into a problem like you got two kids fighting, and I'm talking fighting, not arguing, fighting. And this would scare other people, trying to, and I even had to learn because I was like, I am used to stay in this bed, you're restrained. Don't move unless I tell you to move. I'm not used to trying to de-escalate or trying to find out or how to navigate. So it was a learning curve for me as well. How do you calm a special needs person down when they really don't know you? But I was good with the weekly visits, so she came to start knowing me, and she would hold my hand when we go out to doctor's visits. So sweet, but it was just like, ooh, because she didn't understand that no, you can't run in the street. No, you have to stay over here. No, don't go up to that stranger. So she needed all that behavior health, speech therapy, physical and occupational. And the caregivers that would come into the home, it was also getting them to learn how to communicate with mom. This is what we're doing. Let alone that, it was also talks about listen to mom. She knows her daughter better than you do. We have a problem as healthcare providers coming in with certain situations and saying what we think is best when we haven't been with that person for years. We need to listen to the family members. That's why we're in health advocacy, right? Um, let's see. Okay, so uh, in March of 2021, her daughter was able to relocate to Texas and she moved into her own apartment complex. So she would come over and assist mom with bathing, dressing herself. And we also got her on the Medicaid waiver program where she could get paid as a caregiver for her older sister. So there were, timesheets and getting everybody acclimated to that, and then hiring other and interviewing other caregivers together because we had tried to go under the Medicaid waiver program and then use the providers that they had. But these people were mediocre, non-caring, unprofessional, rude, ghetto, obnoxious people. And they don't get paid much either. So we have to realize that too. So you get what you pay for, right? So these people are practically probably making $9, $10 an hour. And they had gotten to a point where we had to have a conversation because they were using mom's washer and dryer to wash their clothes. So that was a
So
situation.
you fired them.
Yeah,
Good. That's good.
Absolutely. And we got another company and then another company. And then after a while, we were told about the CDS, Consumer Directed Services in Texas. So it's another program under the Medicaid waiver program where we could, as the caregivers, we could hire and interview our own caregivers. So when we were able to do that, then we got some relief for the daughter that had to come over and take care of mom and take care of her sister. She had no life. So it's not a diagnosis. She had caregiver burnout. First of all, there was family dynamics between her and her mom from earlier in life. We all have them. And now you are forced, or you feel like you're forced to care, and you have no clue. You're in a new state, you're in a new city, you don't know anybody. And now you got your mom that you got to go over there every day, and you got your sister that you have to go and take care of every day. You have no life. And there was lots of frustration, and she started getting sickly herself because of burning herself out. So we tried to implement a program with the four of us actually, that daughter who moved here and I would take mom to her doctor's visits, and daughter who moved here because she had more control over her older sister, more so than her mother. It was almost like they switched roles. She became mom and she had two daughters and a dog and a husband. So she had four kids. Okay. So the thing is that my goal was to create a program where she can eventually have a life, where she could be daughter and sister. So if we want to fast forward to today, there was a lots of just different changes, rocky roads. So eventually, when mom had the stroke, she went home on rehab. We got her cardiologist, a neurologist. We got her on a smoking cessation program. She started back smoking, but when she got on the program, um, so her navigation was pretty simple. The other daughter with Russell Silver syndrome, not so simple because we tried to keep them together to age in place as long as possible. But then when it got to be too much, you can kind of read the room looking at daughter number three. I mean, the baby daughter, and then the oldest daughter, and then you're seeing mom. Those weekly visits turned into, okay, now we need to get mom into an independent living, but first, we need to get the Russell Silver child into the foster care home that is not going to totally take over, where the family can still be involved. Because I know you guys aren't surprised, there's many times that special needs clients or people, they get left behind or left or put away, and the family doesn't come and get involved. I wanted to make sure the care providers that were going to be taking care of client number one, Russell Silver, were aware that these clients still want to be involved, whether that is incorporating family visits, whether that is weekend visits, whether that is letting them in on the care planning sessions, whatever it is, we are going to keep this family involved. And that was the fight, because the mindset is that, well, why are they wanting to know? This is not the type of family just going to run off and drop their loved one in a home and then go live their life, and then they know the loved one, right? So we wanted to make sure that the caregivers understood they still want to have visitation rights. So Russell Silver client, what daughter who moved here and I did, we couldn't always tell mom this, meaning that we had to go and investigate the homes first, then bring that information back to mom. Because anytime you say something, mom is going to knock it out the wall. Oh, they don't know how to do this. Oh, they don't know how to do it, but mom is not doing it either. So it was baby sister and I going on a lot of, home visits to different homes. And I'm looking at it from a nursing perspective. She's looking at it from, of course, the caregiver perspective, looking at her place for for her sister. So we finally found a place and mom agreed, and we had transitioned from one county to another county, found a beautiful home. The lady is very lovely. Now client number one not only gets physical therapy, occupational therapy, behavioral health, speech, she also gets day hab, where she can go 5 days a week. They take her, the host homeowner takes client number one to day hab 5 days a week where she can get activities. They do outings, they do games, they keep them stimulated because what was happening, the reason mom was getting so frustrated with client because she didn't know how to stimulate her brain. Remember, I told you guys she only slept 30 minutes out of a 24-hour period. These last 2 or 3 years now, we've adjusted medications because we've been able to work with behavioral health. We've been able to work with her doctors, her psychiatrists, and now she's on a medication regimen that she is happy, she's stable, she's enjoying life. And so now that mom saw that, now mom can concentrate on herself. So we just did a repeat. Daughter and I went and looked at assisted livings and independent livings. We worked with Mitzi. She came out, met the clients, and we were able to kind of go physically and smell, eat, taste, talk to the residents, look at the independent living, see what type of activities. So mom currently, fast forward to today, she is in an independent living. She moved in September of last year. Uh, Russell Silver child moved into her host home in August. So they gave mom some time to, get acclimated a little bit. But then we had issues with the apartment complex she was moving out of, because remember, this is a college apartment complex. They wanted to charge her double the rent because she was getting ready to, she had to break her lease. But my lovely, lovely assistant or co-advocate in Dallas was able to look up the American with Disabilities Housing Act and able to present that to the apartment. So we were able to help her get out of paying that last month's rent. So she was able to adequately move into the independent living. Now, the independent living situation is a whole different story because she's still adjusting. But so current status, client number one successfully transitioned to a host home service provider. Uh, Mom and daughter now, that's the caregiver. She gets to go and pick up her sister, take her to her mom's when she wants to on her schedule, and they can have outings, they can have birthday parties, they can get along. Client number one, she's getting that day hab Monday through Friday, 8 to 5, behavioral health, speech therapy, primary care services. She has a psychiatrist, wonderful program. Client number two has relocated to a independent senior facility where they provide 24/7 kind of supervision is independent, but they provide 3 meals, 7 days a week, housekeeping. So daughter that moved here, she no longer has to go over there and do housekeeping and cooking and things like that for her mother. She can go and visit her mother or choose what visits she wants to go to as far as doctor's visits with her mother. Now client number three, which is the daughter that moved here, she reports reduced stress, less caregiver burnout, but now she can be a mother, she can be a sister, and she can be a daughter for her loved ones, knowing that they have the 24-hour supervision and care that they need. And so now it's just, okay, do you want us at that doctor's visit or you want to take a break? So she gets to pick and choose now, whereas before she had no clue. And now she's even getting acclimated to where she kind of knows from the learning experience that she's had. She knows that she has to call the doctor for this or get in the my chart for this, or, we need to call a care plan meeting. She knows how to conduct a care plan meeting now. So now we're just kind of as needed. So the plan overall was to assist with Medicaid and medical services for client number one, medical support, And advocacy consisted of arranging transportation and accompanying the clients to the doctor's visits, attending care conferences with the Medicaid providers, because they would have to have conferences in the home once a month, ensuring that the clients were heard and understood and treated with dignity and respect. Since mom didn't have transportation, we had to find her reliable transportations, either with a transportation company or well, we didn't do that one. We have a system here. It's called DART, Dallas Area something transportation. That wasn't gonna work with her because no, she eighth grade level, and Dallas is huge. um, so we provided weekly in-person guidance and assistance with the internet, because whenever she would have to have a virtual visit, I would take my laptop over there and help her conduct her doctor's visits. Stroke crisis response, when she had the stroke, in her mind, she had never had any health issues, but these were all incubating. And then that's when the crisis happened. So obstructive sleep apnea, hypertension, all the things that can happen when you don't take care of yourself. Acclimation to medical providers for her. It was also getting her primary care, a neurologist, a good home health company that was going to be communicative and cooperative. And then above all else, teaching these clients how to acclimate and get the services they needed and have their voice. I used to hate this when my ex said it, but now I don't tell them. It's not what you say, it's how you say it. So it's teaching people how to advocate for themselves, because client number two, the one with the stroke, she didn't have very much patience because she expected stuff now, right? Some of the resources that we utilized was, of course, the Medicaid waiver program, home health service providers. So any home health service provider that came in or were acclimated to them, we at Your Healthcare Nurse Advocates, we're going to send you over a HIPAA release so we can talk with you and we can help, people navigate, and we're making sure that the client's voices are heard. Transportation companies, there are several here in DFW. They are very expensive. And then, of course, assisted living locators. And last but not least, the medical binders that we have created. The medical binders came in very handy for these clients because they don't have internet. And if she did, by chance, get on the patient portal, she don't know what she's looking for. So what we would do is anytime we go to the doctor, we pull off 3 days later, 48 hours later, we get the progress notes, not the summary. It's a waste of paper. We get the progress notes, and then we read those progress notes and interpret it for the clients, and then take it and put it in their medical binder. So if they're coming in from out of town, they don't have to wait to get on the internet. What's your password? Well, by then you are frustrated. So we have utilized that as well with these clients, and it helps tremendously, because if I went to a doctor's visit and the other daughter didn't, or she went with her sister, then now we got to come back together and be able to say, okay, what did the physician say? What did they mean? Does the physician A know the physician B said this? The physician C know that they prescribed this? Lessons learned. Recognizing diverse needs, because I was hired for one and we got three in one, right? Uh, Recognizing that client number one needed services for Russell Silver, ADHD, things that she needs for special needs. And then client number two, recognizing she also needed services from medical providers and that navigation. And client number three, recognizing that we offered her to go for some psychological counseling, uh, things, group things that she can get acclimated to, because she's approximately 35. So it's a huge, huge undertaking. And creating effective care plans for each and every one of them. and then incorporating that into the overall care plan. So the overall care plan is age in place, get the resources that you need, and decrease caregiver burnout. So we helped to do that. Managing client, family and caregiver relationships. Ooh, yeah, that was, yes, that was a challenge at times, because we remember that the nonverbal, uh, with Russell Silver, she was 36 at this time. So I had to get in the mindset, this is not a cute little 8-year old. This is a grown woman that needs things, and maybe she's going through some hormonal changes when she has these outbursts. She can't say I'm hot or I'm hurting, or she had to display her behaviors in different ways. Or when she's uncomfortable, when she's really uncomfortable, she act out. She'll eat leaves. She'll hit her head against the wall. She'll scratch herself. And this is traumatizing if you're not a healthcare provider that has seen this before, right? Um, and fourth was championing client-centered advocacy. What does that mean? I learned so much with this because when these healthcare providers come into a home, they need to respect your home and they need to listen. And I had many times Shanae had to wake up and say, oh no, we're going to start over because you're going to listen to what she has to say. Because if it wasn't for her, you wouldn't be here. So we need to involve them in the plan of care. We need to make sure that she understands. And sometimes that may be explaining it to mama several times, but mama still knew her child and different ways that she used to care for her child. So advocating and championing for all parties involved. When you take on a client, you're not taking on just one client, you're taking on the whole family. And so they all become your clients. So we've all done tailored home care, one under one roof with several clients. So that's my study. And it still continues. They're still my clients. We talked to them today, Michelle and I. And it was a little bitty problem that could have turned into, had they not had the guidance to know this is the why behind the problem, then it could have blown up. Could have got very confusing. But at the end of the day, we were able to say, oh, that's just oh, I know what happened. So to be able to help them along the way so she can breathe and visit her mom and her daughter, her sister, not her daughter, her sister when she wants to.
Wow, Deidre. I mean, I've had couples where they were both had needs, but three it's a lot in one family. It's kind of a interesting story. You mentioned Mitzi, and I wanted to just remind folks that our March 10th community conversation was Mitzi Watson, and she talked about adult family and residential homes. They're called different things in each state, but it's a really, I think, I knew a lot about those homes, but I learned a lot from Mitzi. So if anybody's interested, you can go back and listen to that. It's in our classroom. Yeah,
And it's so funny because I could have broken this up.
so many ways.
Yeah, it was so many lessons to learn. And not only that, I feel like we all, when you have one client, you don't have just one client. You got their husband, you
No,
got their wife, you got their loved
yeah,
ones. Really, you all are handling more than one client because that's what advocacy is about. But
yeah,
de-escalating and boundaries.
yeah, yeah.
It's like, whoa.
Um, so does anybody have questions for Deidre? When we were doing the practice session, I had so many, but I'd like to hear what everybody else has to ask. Those of you, and I have actually not had a lot of experience with disabilities, and that a lot of what you had to do, Deidre, is resource finding, where you didn't know exactly, where to find those. So, um, and Chloe put the link in for the community conversation that I was just talking about. Yeah, anybody else have questions? And actually, Deidre, people should go to your website and see um, your medical binder that you were talking about, because it's actually a really good resource if people don't have online access, especially. So,
Mhm.
yeah. Questions, comments?
I have one if no one else is gonna. So Deidre, can you just talk a little more about how you specifically got paid or got, reimbursed for your time on this case? Because there was so much time and everything in it, and we all know that advocate's time is valuable. And I know this was one where you were starting as a baby advocate. So can you just talk a little bit about that?
Oh, yes. So for me, I'm comfortable with chronic illness, ICU. So when I started this business, I said, what are you comfortable with? Don't try to do, because it's already hard enough to start a business. Um, so don't get out your comfort zone. So I stayed in my comfort zone. So basically what I do is I do a in-home needs assessment. And during that in-home needs assessment, I like to have everybody there that could be or possibly be or wants to be or involved. Um, then after that, I asked for this time I didn't, because that was when I was a baby advocate. I didn't get a retainer. So when I heard about the income challenges, I said, oh, okay, you know what? I'll just do you guys at half the rate that I normally charge, and it's 75 an hour. So at the end of the month, I bill at the end of the month, so they get a detailed invoice on everything that we did. So documentation, 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 documentation. And I would just bill that one rate. Anytime I'm in the home or with them, I would bill that one rate, whether I was seeing client number one or client number two or both of them. Because either way, I'm in there for about an hour. So you get 30 minutes and you get 30 minutes, or you get 15 minutes and you get 45, So that's how I build them and still continue to build them. Now, as we came into this new year, because mom lives in the independent and Russell Silver lives in the host home. Well, now I really don't have, other than, hey, how are you? Here's a birthday gift, when's the birthday party? I'm coming to the birthday party. Oh, we're going to meet at such and such. I don't charge for that because I'm having fun too. And then even mom, like after her doctor's visits, now we can go someplace and eat. So she can get out of she needs to make friends, since her whole life was the Russell Silver daughter. She has no social skills, none. So uh, it's been like she's in high school at this independent living. Um, so now I get to be that friendly, personable advocate. And now mom can look forward to, so now we can just kind of wean off our visit. Because at first we were in there every week, sometimes twice a week. Uh, and that's not even counting doctor's visits and things like that. So now it's been weaned down to, oh, maybe twice a month, including doctor's visits. Or if they need me to jump in because I have access to her patient portal, or I can talk to her doctor and her doctor knows me if there's something that's going on. So now they're at, a lower level of payment.
But if they've been working with them for 5 years, is that?
All my clients basically, so with my advocacy business, my clients are with me for a while.
Yeah, that's
I have
great.
several, because for me, with chronic illness, I'm like, okay, when we're in crisis mode, I'm here, I'm there, da, 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 da. But then I had an 80-year-old client. She went to her high school, 56 year high school reunion. She didn't need any care until she broke her hip. I didn't even get the boot scoot. I was like, okay. But now she's back up and, doing what she loves to do. And so I just do, hey, how you doing? So I kind of keep my clients on archive. So when life happens, I'm here.
Yeah. And I think it's impressive that, so you say you were a baby advocate, but you got a referral from a fellow advocate in Arizona, which says something, I mean, it's nice to know that people know who you are and refer to you.
Yeah,
Um,
that's what I love about our industry.
yeah. I'm curious, um, so if mostly you see or work with chronic illness, where do most of your referrals come from? Like, is it word of mouth? Is it your marketing through? I know you do a lot of social media, and maybe you could talk a little bit about your business and how you get clients.
Sure. Um, I don't do the marketing anymore on social media. Pay somebody. But in the beginning, it was word of mouth from networking, 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 offering to speak at these networking events because they were always looking for a speaker, to talk about your business and networking. And then at the networking, I would I hate the word target, but I would pick out two people that I'm like, oh, that might be a good synergistic relationship. So I'm gonna call, or they gave me their card. I gave them my card. Let's set up a sit down, coffee, happy hour, whatever, to meet. And I'm not selling you, and you better not sell me the first time we sit down, because the meeting will be over. But anyway, um, I want to know who you are. What's your why? Why did you do this? How are your clients? What do you do? I want to learn who you are so that when I refer, I can have that peace of mind that I'm referring to XYZ patient advocacy. I've sat down with him or her, which is not many patient advocates in Texas, y'all. So Michelle, me, Leah, Terry, I'm kind of one hand and the other one's there 4 hours away. So Texas is not like where we can reach out and touch. So you're gonna be driving. And so that would be getting over my fear of speaking out about what it is that I do, getting over my fear about what is it that you do? Oh, oh, that might be a good service. Okay, so is there a way we can synergistically collaborate? I'm not going to give you my client list. I don't want yours. So it's all about, and then I'm watching you in the arenas that we network in. Because there's lots of opportunities for healthcare related networking here in Dallas Fort Worth.
I'm curious, has anyone else on the call had a experience with a disabled
Mm.
clients or people that have maybe a similar need structure? Because I think it's challenging. It's very challenging. If you get a client who fell with a broken hip, it's sort of, you kind of know what's going to happen. But if you got this family trio, it's like you really don't know what's going to happen or, how it's going to go. So I'm just curious if anybody else had experience.
I kind of have one. It's one that Deidre actually helped me get. They found her on the GNA site, and they actually live in Abilene, which is about 2.5 hours west of here, or from where I'm at, a little further for Deidre. Um, so uh, the patient or client per se has, let me see if I can get it correct, the word. It mimics Parkinson's. She has the shaking and things like that. Gosh, hold on. Corticobasal degeneration is what it's called. It's very, very rare. Um, anyway, so her and her husband had been together 55 years. She was diagnosed with this, I think, about 4 years ago. They say the lifespan is 4 to 6 years. So, in their mind, she's ending nearing the end there. So anyway, so she is in, he moved her to an independent living community about a year and a half ago in Abilene. And recently she was moved over to the nursing side, which is basically a nursing home side. So they call me because, or Deidre, when I talk to them, the community that she's at, they're wanting to kick her out because they say that she's become aggressive, that she hit and scratched at someone. Well, I go and meet the family. They're absolutely wonderful. The daughter lives in Georgetown, dad lives over there. They're highly intelligent, all three of them. She's an only child. She works with the IRS, and so she's insanely busy right now. And so I go there and I find out that, for one, at this nursing home, the part that she's in, they don't know how to deal with people that have dementia related memory deficits. So they don't recognize that when she was aggressive, she was trying to communicate something to them and they're not trying to understand what's going on. So anyways, I get over there. There's another community that's very close by. It has a memory care. Dad has been very hesitant to move his wife there because he's experienced something, a negative thing there, a lady that he knew that was doing wonderful within a short amount of time, and moving over to this particular place, she passed away. So his impression of hospice and palliative care is, even though he's worked with it before, that they now have control. And if they're ready to let you go, they'll just start drugging you up until you're on, so he thinks that's what happened here. Long story short, I sweet talked him somehow into going over there and touring this community, which is absolutely adorable. The new wellness director, or LVN, I'm an LVN, she's an LVN there. He met her and it was wonderful because she works the way I do. All the families have her number. They can contact her directly, day or night, doesn't matter what's going on. She toured the whole place with him, explained everything to him, and he walked away. He was ready to sign up. He felt so good about it. He felt like she could, really help him. Anyways, next day, they set it up. Tuesday, they signed the contract, I think, and that following Friday, they got to start moving in. Anyways, yesterday they moved her over. The community that she was at previously, they did not send any medications, which the phone call I was on, Deidre, I can tell you this part. They didn't send her with any of her medications. So she's on carbidopa, levodopa. She's on Seroquel 3 times a day. She's on clonazepam at night, trazodone at night. What else? She's on quite a bit of stuff. They said nothing. So this poor lady, who they consider as having behaviors and being aggressive, knowing this, and last week her medications were changed. They sent her to a new community with nothing at all. Come to find out, meds had been increased weeks and weeks before. They never increased them. I mean, this place was awful. It was so sad. So we all worked together this afternoon. We got a hold of the nurse practitioner, the Jerry psych. We got everything together, and now I've totally lost track of what I was getting at. But anyways, it's all worked out. It's been a struggle, and especially since it's long distance. The daughter had to go back home. She's in Georgetown. Dad's over there trying to deal with this by himself, with his wife basically losing her mind, but it's because she's not getting her medications. And we've got it all settled down, and she's really doing well. And I have to say props to the wellness director that's over there, because again, she is like me, and she called and we found the right providers, and she got a telemed visit with a different Jerry psych provider this afternoon, and she's going to be medicated as of tomorrow. So yeah, it was hard.
Great.
But thanks to Deidre, she helped me get them. And it's my first contract
Good for you. Congratulations, Michelle.
Thank you.
I mean, it sounds to me like the thing that you were able to create, which we all know is the basis of any relationship, is trust.
Yeah.
Because if they didn't trust you, they wouldn't have allowed you to do that,
Yeah.
or even go with you to see a different place. So that's
Yeah.
great.
Yeah.
Yeah, that's
It's been
great.
good.
Yeah. Anybody else have an experience or question for Deidre? I have to say, Deidre, I'm not sure how you kept track of all that because, you know, every every client had different issues going on, and you had to deal with different providers and, all kinds of insurance issues. So it must have been very all consuming
Now,
when
I
you,
won't say that I didn't deal too much with the insurance. Uh, I'm I'm very ignorant when it comes to insurance. And I feel like that's when I subcontract because I feel like in order to do these clients' services, you have to have the people in your team or within your reach that maybe you specialize in something else because I don't want to muck it up, right? So, yeah, I love, love, love what I do, and it's been lots of challenges. But if I'm not challenged, then there's no change, right? So, I think Lauren had a question. Oh, okay.
Yeah, actually, I was wondering, did you have like such a robust medical binder program set up when you started with this family, or did you kind of develop it because of them? Yeah,
Oh, great question. So I developed this because of lots of my clients.
yeah,
So I would even get frustrated. I'm a nurse for 25 years. These patient portals are, oh,
yeah,
like, oh my goodness. And then some of them are mediocre. And then even when you get on there, oh, so if I'm feeling that frustration, my clients are feeling that frustration. 80 to 95% of my clients are over 65. They're in their 80s,
right,
their 90s. They don't want to get on no patient portal. They don't have no time for that. Ain't nobody got time for that. It's like, okay. So I spoil them because I know I can get on there. I know what to get. I don't have to like, okay, well, to go here. Okay, what does that
right.
mean? So to decrease that frustration, God bless me. I don't know how with being able to create these worksheets. And what happened was when I started using the worksheets for my clients, another advocate said to me, "Oh my goodness, that is such a great idea. You need to
Right.
sell those worksheets." I'm like, "No, I don't need to sell these worksheets. These are my worksheets." And she's like, "Oh, but Deidre, these are just so good, especially for those people who are we still got a generation of people
Oh,
who
yes.
I'm one of them."
I mean, I'm a millennial, but I still have a running list of notes next to my desk that are on paper at all times. So look,
Yes.
I love paper too.
Me
Uh,
too. And it's nothing like when these older clients, when they are got the paper in their hand of their perfect example,
right,
the client, the mother, she stopped smoking for about 2 years. And her CT scan before she stopped smoking had one nodule. Then we got another CT scan of her lungs and it had another nodule, but she had quit smoking. But then she started back smoking. Now she has several nodules. So without somebody keying in and honing in on that, like you've had some changes,
right.
I guarantee you people are not doing that going on the patient portal. I will argue you up and down. But when you can have, oh, my mammogram was done in May of last year, so I know it's time for me to call and schedule around the same time. And then moving forward, and I want to be able to see, that didn't say that last year. Now it says this. Same with your labs. So that's what I do with my clients. It's been very, very, very beneficial. I spoil them. I'm on the patient portal. And then
Yeah, so my question is like, do you end up updating all of it for them? Yeah.
I do. So some of them are thicker than others. And
Well,
so
of
what
course.
I'll do is that now I don't do it unless they signed on as a client.
Sure.
But that helped me create an advocacy assistance program because some people you meet and they say, "Oh, I can't afford that hourly rate." But
Hmm.
okay, if you get the medical binder And then I know that you are putting in your CT scan, you're putting in your last doctor's notes. So then we can schedule that visit. And I can say, oh, your doctor's notes on June 7th said dot, 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 dot. Did you do dot, 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 dot? You know, how did you do that? This is
Right.
probably what you need to ask at the next doctor's visit. So it's very beneficial for that paper because the patient portals, there's one good one. The
Yeah.
reason I say it's good because the doctor's notes are in there.
Yeah. Yeah.
Many of them don't have the doctor's notes. That's where the goal is. People don't
Right.
understand it's the progress notes, not that little summary they give you.
Yep. Yep. Mm. Yeah, very cool. Thanks
Yeah,
for
and it helps people to
sharing.
be able to plan for the next steps because for me, I'm type A. I'm a planner, planner, planner. Plan A, plan B, plan C. So that's just how I'm made. And we create that plan, and then my charting system, which is my Juna, helps
Mhm.
tremendously. You got to have a charting system that helps you stay on top of be organized. And then the binders on top of that help me stay organized in the home.
Right.
Mhm.
Yeah, that makes a lot of sense.
Any other questions or comments or stories? We're a little after 6 and we can go longer or we don't have to. It's kind of up to the group. Um, who was I was gonna ask, so Anne Jacoby, I know, so when I had our for-profit business, we did have insurance specialists, like what Deidre said. I am not the insurance specialist. I'm a nurse, and so I didn't really want to know everything there was to know about insurance, but I know that Anne and Diane also have an insurance specialist, and I think that's not uncommon for advocates who are practicing who don't have that background. So, Anne, can you just talk about a little bit about that? Because I know you've been using that for a long time.
Sure, I really appreciate this, and it's having graduated from Texas Women's University and also living out in the DFW area for about 15 years. Deidre, I'm picking up the accent again all over, so thank you for that. But I love New England, and as Beth said, I've been working with this fabulous lady for about 10 years, and we have the bandwidth where my background too is as a nurse in my former life. And before I joined Health Assist, I really didn't know that much beyond the basics of insurance, Medicare, and the like. And so when I joined, I really appreciated how much I didn't know and learned the important intersection of managing the medical needs as it relates to insurance benefits, et cetera. But also realizing that because of this unevenness of my knowledge being much more clinical, I could appreciate people who did specialize in Medicare, in that area. Now, Deidre, unlike what you were describing, and I was fascinated with that, we don't often specialize or work with people with disabilities or Medicaid, but we now have uh, 3 insurance people, insurance advisors, and especially with all of the uncertainty with Medicare now, they are have their strengths in different areas. Sometimes it's the federal government, it might be veterans benefits and the like. So I've really learned to rely on them. And as my clients need change or as I seek advice from them, it's been very, very helpful. But we find that there's still quite a few advocates who would like to learn more about the insurance side and especially when to seek advice and when those intersects of needs really are important to realize and to meet. Can you push the alarm before?
Thank you. And I do know that the BCPA has really increased the amount that is required to know about insurance. And I think that that's good because we all have to have at least, a good baseline when we're working with clients. So,
Yeah. So Michelle and I have a client. So I'll explain me and Michelle's relationship. For some reason, God has sent me two wonderful advocates that I've been able to subcontract with, and they've just started their businesses, but I figure it's a learn as you grow type of situation. So Michelle and I share this client. She needs medical billing and appeals stuff. So I was able to call Sarah Jane, which is another advocate. That's her arena. So why would I muddy? I've got enough with chronic illness. That's enough. I would be doing her a disservice if I didn't acclimate somebody else with that specialty so I can focus on what I specialize in because I'm good at what I do. I'm not good at insurance. So with me knowing this, I'm like, let me find somebody who's stronger. So Sarah Jane has offered to we're going to pay her. I feel it's worth it to pay her to teach us how to do this if we could get started on it and maybe we can add it to. But to me, it's all about this industry is all about us working together. I get very leery, and you may get upset with me saying this. Oh, well. I get very leery when you find an advocate who says, I do it all.
Yeah. Yeah. And that's why these, I mean, not just case review, but networking and all of these
So
events where we can be together and learn what our strengths are just really important. So, yeah. Anyone else have questions for Deidre about the case or comments or stories?
Tracy says she used my Juna as well. It's a great system.
Yeah.
I actually love it
Yeah.
quite a bit. And I was texting or chatting with Deidre. I have 25 years of medical insurance background with one of the biggest carriers. I'm not going to say who. So I use obviously the insurance background a lot. So, and appeals as well, right? So,
Wonderful. And see, that's so good to know because as Beth was saying, that we're trying to beef up our networking as
yeah.
well. I think the case conferences are powerful and networking is powerful. And so when you come to these networking events, you can get to know somebody that you can probably work with. Because Tracy, I didn't know you did that. So now that I do, it's like,
Yeah,
oh,
yeah. And so I get called, Tracy, I don't know the insurance, because I get benefits, right, on top of that. So I told our operations people how to set up the claims. You pay it this way, right? And you have to learn state laws, federal laws, because
hmm,
they impact the benefits a lot, right?
yep.
Tracy, where are you?
I'm in Tega Cay, South Carolina, so right outside of Charlotte.
Okay. Okay.
Yeah,
Yeah.
so I've been
Yeah.
certified since 2020. So I started because of
Okay.
my parents. So, my family's like, it's benefits. I don't know, Tracy. I mean, they don't even look at them. They just hear.
No.
So,
No, it's good to know that you do that. There's only so many folks that do the insurance and appeals. So
yeah,
it's great
but
to know that.
that's
Yeah.
itself, the
Yeah.
appeals.
Thanks for sharing.
Yeah.
Yeah.
Yeah. Deidre, I may be reaching out to you because I have someone in Texas. So, yeah, we need to talk, right? Because you with chronic illnesses and stuff. And so yeah. So
Send them our way.
yeah, and I could call you at your number. I went on your website, so I can call you. So
Yes, ma'am. Or you can set up a consultation or
yeah,
whatever.
I'll do that. Yeah, because I have someone that I think could definitely benefit, especially with your background with chronic illnesses. So
Yeah. And so that I'm sorry, Beth, Michelle was mentioning the client that she just got. So I got the call from GNA and I'm at my max
okay, okay,
uh the other day. Hold up. So when I got the call from this client with Michelle's background, I knew her background would be more beneficial for this client. Plus, I didn't want to take on another client when I have 15 right now.
yeah,
Uh, that's my max as far
yeah,
as I'm concerned. Everybody's not at the same level, but
right, right. But
but
it's a lot. Yeah,
it's
it's a
like
lot.
I don't want to be a disservice and I don't want to create burnout in my own self, right? So when I was listening to this client, I was like, "Ooh, I think Michelle will be a better fit." So let me call her up because see if she wants to do this 30-minute phone consultation with me, and it worked out great.
Okay, well, we'll be talking, and Michelle, maybe you again. I'll kind of let you know. Here's what's going on, and um, because it may be beneficial for her.
But we kind of figure, the other lady that works with us, Leah, she works at in a hospital and ICU. So like, between the three of us, we have a lot of bases covered. So if there's something I can't provide that obviously Deidre has more experience in, we just shuffling people around and make sure that they're cared for. So it really doesn't matter, like you just said earlier, who does it, as long as they get the support and the care that they need to have a better quality of life. So
Absolutely. So yeah, well, thank you guys.
That's great. Yeah, this is how people get clients from
Yeah.
networking.
Well, I think it's also fun to bounce ideas and use each other as sounding boards. And, what do you see? What else should I be thinking about? What has been your experience? And I love to do that. So it's just a win-win situation. Deidre, this is Anne. I was interested in your background, which seems to have a lot of certification and specialties that are so serving you well. What has been the biggest surprise as you started as a baby advocate? What was that, and how did you move forward?
Wow. The biggest surprise as a baby advocate is basically being able to serve in this way, and people are paying me to do it. That was the biggest surprise, because like I tell you guys, every time a client pays me or when I hit send on that invoice, I'm like, oh, wait, they paid. So it's like, oh my God, they pay me. So I think, that has been so rewarding, because also being on the other side, in the ICU and the hospitals and the home health, it's just like I was becoming one of those nurses. Nurse rat or whatever.
What does that mean? What are you thinking of?
One of those nurses is always hateful, mean, disgruntled, mad at the world.
Okay.
When I found this, it fulfilled my belief in nursing again.
It's
Because
hard to work in our system, as a nurse or a doctor. We have a couple doctors on the call.
Yes,
It's very challenging. And
and now you get to see the other side. It's wonderful.
Yeah. You still want to do the work and help patients, but not be in that crazy system.
The thick of things. Okay.
Yes.
So
Thank
that
you.
was the biggest shock for me. But this is not my first business, but it's my purpose. It's my last business. So I had a cutting edge, number one, because I have had other unsuccessful companies, but still. I feel like this is where I am. And that God has blessed me with the backgrounds that He's given me. So I feel more confident. I love being in my client's presence. There's nothing like it. Michelle and I were talking about this earlier, body language. You get to see, are they absorbing this? Is the doctor? So you get to see all these dynamics, even between the family members. I even get to be with them at the end of life and go to their funerals and stuff. Now, their celebrations of life is so rewarding. So great question. As a baby advocate, I was scared, but I wasn't too scared, because I was used to going in people's homes and used to giving presentations at work and training nurses and things like that. Did that answer?
Thank you. Yes, thank you very much.
So
Anyone else?
Think about what it is that you're good at and do it. Do it. And if you're weak at something, don't focus on your weaknesses. Find somebody who has that strength and do it. Don't do what I did. Oh, I'm not good enough. Oh, I'm not smart enough. Oh, I'm not whatever. Just do it.
Yeah. And I know Maggie Pheasant, who's on the call, moved in the Seattle area from one major city to a much more remote part and has had to create a business there. And I think it was challenging, but it sounds like things are going well. Maggie? Oh, maybe she's not there.
I saw it go off and then it came back on.
No, I'm
Oh.
here. I'm here.
Oh,
Can you hear me now?
yes, we can.
Oh. So my first major client over here, I really didn't know people, but I've always somehow found this knack to find people I trust in any business I've been in. And my client is the daughter of a woman who was 89, and my client lives in London. And somehow she found me online and called me. So her mother had been through 5 major transitions in 5 months and was moved up here by the daughter that lives in Spokane, thinking she was going to live with her daughter, falling, ending up in an ambulance, which is a big deal, ending up in ER and then in skilled nursing. And then the daughter that was up here found her in assisted living. So when I met her, she had been through a very serious hospitalization. They wanted to amputate a toe. She didn't want it. So she went home for 30 days on a lot of antibiotics. Then she had the toe amputated. Then she went to skilled nursing. Then she went home and she fell back to skilled nursing and then flying to Seattle. And then all the stuff in Seattle, or Spokane rather. See, I still have a hard time. And I thought when I met her, I was going to find this little tiny shriveled up person. Not at all. But I had to put together then a care team for her. Where she lives, she has her ARNP, but she needed physical therapy. She needed ongoing care with this toe. Her teeth were very bad, et cetera, et cetera. And so somehow I put together a really excellent medical team. And then I did a combination of, I was her care manager, but I also did companion care because the daughter that was here just kind of opted out. And I still love her dearly. She was born in West Virginia in the holler and married a guy from the academy. I have no idea how that happened, but loved to be out of doors and just spunky. And now, unfortunately, she's moved rapidly into dementia. So, but it was that whole thing of putting together a team.
Well, especially in a new place for you.
Yeah.
Like you didn't know the resources there. So yeah, I think it's very gallant when people are able to kind of do that. It's great. Thank you for sharing.
Awesome.
Anyone else? We are at 6:20. We can keep going. We have 10 more minutes if we want, or we can end early. It's up to you guys. I know for some of you on the East Coast, it's late. So for Deidre, is it your bedtime, Deidre?
I got 2 more hours.
Okay.
I would just like to say one thing. Being in Spokane, I would really appreciate any referrals over here. And Deidre, I'm so glad to know about you. And I think I don't call on other advocates as much as I should. I know nothing about insurance, so I'm really happy to know 2 people on this call that are in that, because I don't mess with it. I mean, it's too complicated and you can't mess things up for a client. I mean, that's just unethical.
I agree. I love it. So you said that client was in New England or?
No. The daughter is in London. The daughter that's the POA. And I'm here. So,
Okay.
and there's another daughter here, but she opts out a lot. That's the only way I can say it.
Well, yeah, family dynamics again.
Yeah. So, so I've been pretty much it, and have a really trusting, beautiful relationship with the daughter in London. She comes over twice a year. But one of the things about her, she's an HR consultant. She ends her emails in gratitude. That's what she says, in gratitude.
And
And
she's an HR consultant.
yeah, and so I have picked up on that too.
Oh,
Yeah.
yeah. And I don't want to sound like a sales pitch, but y'all, if you start coming to our networking events, this is where the magic happens and the relationship building starts. Because as an advocate, like I started off the call, I feel like I'm out here all alone until I when you meet another advocate, you're like, oh, you're an advocate too, like, so when you come to these networking events, you never know who you will meet that could, you can help each other out. Sarah Jane, I think she's in Washington. Where's
She's
Sarah
in
Jane?
Seattle.
Yeah, we're in Texas.
She's in
So it's
Seattle.
just
Yeah.
like,
So yeah, Deidre, Sarah Jane, and who else?
Melinda
Melinda
Johnson.
have planned out our networking, and the next one is April 24th, and it's about, so you want to be an advocate, and you can ask, they're all board members for us, and you can ask any question you want. I also, before we're done, I wanted to encourage everyone to attend our movie screening of Angst. It's March 24th, so coming right up, and it's a movie about anxiety, and I think we could all say that we current events here have created a lot of anxiety, so please attend. It's pretty I want to say $15. I can't remember, unless you want CEs. So would love to see you all attend that. There is a live panel and the movie. So, and it's next the 24th is next what?
Monday.
Thank you. Yeah.
What time is that, Beth? In the Pacific Coast.
That is a great question.
6 p.m.
Actually,
Central.
Chloe put it in the chat, so you guys
Okay,
can
okay.
see it. Yeah.
Mhm.
Thank you,
Mhm.
Chloe. Yeah. So any other comments, questions, discussions about networking, or yeah, we try really hard to bring advocates together at the networking, and then our community conversations are really focused more on like a public health kind of topic, and we have the public, anyone, and it's free. So those are, I think, really valuable. The case reviews are really more for advocates who are practicing, and so we're trying to hit all of our audiences with our programs. So if you have any comments or wishes or want us to do more of something, let us know. We did increase the case reviews this year because people asked for that. So
I was going to say the networking part, as I've told Deidre, it's hard when you go from being a nurse
oh yeah,
to I feel like I jokingly say I feel like a used car salesman out there, like I'm, pushing drugs or something, trying to, but at the same time, when it's something that is worth it, in the
Yeah.
same token, it's easy. You're not really selling it. You're just making people aware of something that none of us realize we need, especially as we age, or those that are not educated clinically. I mean, you don't realize how important it is to have someone on your side helping
Yeah.
bridge that gap. So yeah.
Yes.
Yeah.
Yeah,
Or even
one
if
of the
people
nice
come to
things
take-
is that I think people they know what a nurse is and they trust that. And I think that's, helpful when you're trying to do this work. So I can say that because I'm a nurse, but yeah.
Thank you. This has been wonderful. Thank you so much.
Yes.
Yeah, no,
Yeah.
thanks
Thank you
for
very much.
attending. I'm sure you'll get a survey afterwards. So be sure to complete that so that we get feedback. And we look forward to seeing you at our next events upcoming. Thank you, Deidre, so
Okay.
much. That was
Yes.
great.
Thank you so much.
I was so
Appreciate your
amazing.